Hello, my name is Lisa Kaasik. For my capstone integrative learning experience, I conducted a narrative review on the risk factors associated with gun violence among children in the United States. Gun violence is a persistent public health threat, and children are the most innocent victims of the crisis. Gun violence is a uniquely American problem, as rates of gun violence in the US are 25 times higher than that of other developed countries. Children are killed at a rate of over 3,000 a year, and an additional 12,000 are injured. These rates are relatively consistent over time, and an increase in firearm purchases and first-time gun ownership over the last several years indicate that this problem is not going anywhere and requires immediate intervention. The causes of the gun violence epidemic in the United States are a little bit complex because of their interactive nature. At the heart of it, though, is American gun culture. American gun culture is the idea that Americans have an almost uninfringible right to own a firearm. It's the idea that a firearm makes you safer when it's in the home, despite the overwhelming evidence that that is not the case, and allows politicians to not take action on the issue because it is enshrined in our Constitution under the Second Amendment that citizens have the right to bear arms. However, basic safety precautions are missing, and it leads to a constant devastation of American youth. That said, this review was done through Google Scholar, PubMed, ScienceDirect, and Medline. Articles were from 2002 to 2021. Initial research produced 136 articles. After removing duplicates, it was reduced to 62. Of those 62, 25 met my inclusion criteria and were considered in this review. Evidence on gun violence and empirical research on it is limited. The CDC, the America's foremost agency on identifying health risks to the population, was banned from using federal funds to research gun violence in the United States, despite its effect on all sectors of the population, but its considerable effect on children. That was recently reversed, and the 2021 budget was the first year that any funding was earmarked for investigating the causes or anything related to gun violence. Back to the review, 12 risk factors were identified. Of the 12, 10 have an effect that increases risk of childhood gun violence victimization, and 2 are frequently discussed in public discourse but don't have a demonstrated effect. These risk factors are access to a firearm, race, age, rural versus urban setting, history of violent or aggressive behavior, socioeconomic status, peer influence, attitudes towards guns, violence, and retaliation, state gun laws, psychological factors and mental illness, and substance use disorder and alcohol abuse. Access to firearms is the single most powerful risk factor for youth gun violence. Children in the United States can't purchase a weapon until they're 18 and can't purchase a handgun until they're 21. However, there are a lot of ways to circumvent that and acquire a firearm illegally. 1 in 3 U.S. households has a firearm, and there are over 330 million guns in circulation throughout the population. Access is linked in nearly every instance of youth gun violence, and access is most common through the home. And adolescents have greater access through peer networks. Gender is also influence, or has an influence on gun violence. Male victims are 80% of early childhood and middle childhood youth gun violence victims, and adolescents, the effect is closer to 90%. Race is important indicator of risk. Black children are far more likely to be victimized than white children. Latinx adolescents are also at higher risk. Any disparities regarding race should be understood in the context of structural disadvantages posed by systemic racism and our system at large, and not in terms of actual racial differences. That said, the adolescent Black demographic is the most common victim of gun violence, and it's a leading cause of death among Black adolescents, and gun violence overall is the second leading cause of death of all American children and teenagers. Age is also a risk factor. Older children are 12 times more likely to be victims of gun violence. Urban residents are more likely to be victimized. The majority of victims are living in urban areas. The effect on urban residents is more pronounced in areas of concentrated poverty. History of violence and aggression is implicated in an increased victimization of the adolescent male demographic. Previous history of violence of all types is a risk factor for greater gun violence exposure in the future or greater victimization in the future. And previous gun violence experience is also indicative of future gun violence experience. And all of this is consistent throughout the age. So child exposure to violence or gun violence increases the likelihood of exposure to violence in adulthood or gun violence in adulthood. Poverty is also intricately linked to rates of youth firearm violence. Most childhood victims are from the bottom socioeconomic quintile. Children born in poverty face a cumulative disadvantage that puts them more at risk. And living in areas of concentrated poverty, as mentioned in the urban risk factor, increases the likelihood that a child will be exposed to violence, which increases the likelihood of gun violence, and also increases the likelihood of being involved in gun violence just by association to poverty in urban residents. An additional risk factor is peer influence. Peer influence operates through several pathways. Peer networks expand access for adolescents to firearms. Peers also have a role in escalating violence. Juvenile delinquency is often a co-offending event, and gun violence is no exception. The presence of peers increases the likelihood that violence will escalate. So if a firearm is present in a violent confrontation, the likelihood that the gun will be used and will injure or kill any of the affected parties is enhanced with the presence of peers and with the presence of firearm. And last, peer influence affects attitudes and behaviors towards guns, retaliation, and violence. These attitudes towards guns, retaliation, and violence also have an effect, particularly in the adolescent male demographic. Casual attitudes towards guns are associated with a higher level of risk, a proclivity to violence, similar to the effect mechanism of a history of violence, increases likelihood, and supporting ideas of retaliation also increases risk of gun violence. State gun laws provide a moderate protective factor to youth gun violence. Gun control legislation should be done on the federal level, but it is not. So states have taken the responsibility and implemented their own versions of gun control measures. The effect of each of these measures is undercut by what's happening in other states. So often states, to have a meaningful impact on the levels of youth gun violence, are forced to implement many policies. So the number of policies restricting in some way access, ownership, whatever, to firearms reduces instances of youth gun violence, particularly among accidental shootings in early childhood and self-inflicted injury in adolescence. Psychological factors and mental illness and substance use and alcohol abuse are both commonly implicated in gun violence, but neither have a very strong effect. The strongest effect of mental illness is in the previous diagnoses of depression and presenting suicidal ideation in adolescent teenagers for the risk of self-inflicted gunshot, and the greatest risk of substance use disorder and alcohol abuse has been linked to an increase in victimization of adolescent males with a history of serious drug abuse in concurrence with other risk factors. The nature of these risk factors are co-occurring. The majority of these don't exist by themselves, and many of them compound risk. Children that have or that fit many of these criteria are at higher risk than children that only fit one or two or fit none. So thereby, addressing gun violence as a whole is necessary to have the most meaningful effect on gun violence. Therefore, my suggestions are sweeping federal legislative reforms, including universal background checks, expanding mandatory gun licensing for purchase of all firearms, extreme risk protection order laws, which are also known as red flag laws, that allow courts to seize weapons from individuals deemed at risk of harming themselves or others, child access prevention laws, which specify safe storage practices for firearms in homes with children, and implement penalties for adults that allow children access, operating gun buyback programs, especially in areas of concentrated poverty with high gun ownership, and mandatory gun insurance, similar to the effect of car insurance or home insurance, incentivizing safer practices by forcing people to pay for it will have an effect on gun violence in the United States. Its individual effect on youth is yet to be determined. The effect of most of these initiatives on youth are also yet to be determined, which leads me to my final conclusion, which is that greater investment in research on gun violence is necessary to fully understand the risks posed to children, to the public, and the causes, so we can be best informed to design policy interventions and solutions so that we can operate within the system that triumphs the gun lobby over the lives of children, and actually and meaningfully help save and protect children. Community level interventions will also have an effect. These can be done with less federal guidance and less funding, but are also require like a greater commitment from the community. Finally, the youth gun violence epidemic requires action from all of society. All disciplines must get more involved, particularly medical personnel. Emergency department physicians have the opportunity to intervene when presented with a high-risk patient. Those high-risk patients, adolescent patients, that are presenting with assault are likely to be victimized later. So counseling on violence de-escalation and gun safety can have an impact on youth gun violence in those specific areas. Further, pediatric counseling with children in homes with firearms and families that own firearms can ensure that the weapon is stored properly and that the child doesn't have access. And basic firearm safety skills to children who have high risk for access can help mitigate the effect of gun violence by ensuring that when presented with a high-risk situation where there is a gun involved, they will take the correct steps to de-escalate and to reduce the likelihood that anyone is injured or killed by firearm. That is the extent of my research. Thank you.